Very often tests are done to determine whether or not a specific molecule is present. Antibodies can be used because of how specifically they can bind to molecules, and an antigen antibody complex after the antibodies have bound to this molecule, which we'll call the antigen. This complex could cause a visible clumping or agglutination, which could then be used to identify whether or not a molecule is present. An easy application of this is the use of the IgM antibodies, which are secreted as a pentamer, 5 antibodies attached to a common base, which can then bind the A glycoproteins or B glycoproteins, which determine blood type. And so when a patient's blood is mixed with antibodies which bind to A and antibodies which bind to B, and then the antibodies which bind to Rh, which is a different class, the IgG, in this case, then clumping can occur, which will identify that yes, the A glycoproteins were in the patient's blood. Potentially their blood type is A, or at least has an A in it, or their blood type has a B in it because of the presence of the B glycoprotein. So these are examples where an antibody's binding to an antigen causes a visible clumping, which can be then used to identify that the molecule of interest, in this case the A or B glycoproteins, is in fact present.